And we begin with some new questions about the battle against coronavirus in New York State. Why are hundreds of people being hospitalized every day despite drastic measures to tame the disease? New York crunched the numbers and results surprised even Governor Cuomo. CBS 2's Dave Carlin live now at Mount Sinai West with more. Dave?
Christine, this was a survey to sketch in some patient details, but it delivered a big surprise. A survey meant to give New York State a demographic snapshot of recently hospitalized patients only deepens the medical mystery that is coronavirus.
We've done everything we can to close down. How are you still generating 600 new cases every day?
In trying to answer why patients keep being brought in and what their backgrounds are, a stunning finding jumped out. The shocking detail as a graph was put up of the places patients come from, including nursing homes. Most patients, 66%, were said to be social distancing at home. The 3-day survey looked at 113 hospitals, getting back more than 1,200 responses. The results suggest that they were not in subways or in taxis or for-hire vehicles or otherwise in public, that they reported not leaving their houses at all.
Were they working? No.
When you take away the percentages of those not working or retired, you are left with just 17%. Essential workers in close contact with the public included.
We were thinking that maybe we were going to find a higher percentage of essential employees who were getting sick because they were going to work, that these may be nurses, doctors, transit workers. That's not the case. And they were predominantly at home.
CBS 2's Dr. Max Gomez and other medical experts tell us they'd like to learn more about the specific questions that were asked, eager for more details.
We have to look at how the survey was done. Clearly, someone had to be exposed in the household. The virus doesn't just magically appear in the house. It had to have come from someone who was exposed and they didn't realize.
Recapping the findings that newly hospitalized patients were not working or traveling, mainly from downstate, a majority of them minority and older, and non-essential workers. There is now a push for enhanced research, new surveys that yield results that are less speculative. I spoke to 2 ER doctors, and they said that they were concerned about these findings as not representing what they are personally seeing, so they did not want to comment on camera, and they wonder if maybe those "I was at home" responses are not entirely truthful. On the West Side, Dave Carlin, CBS 2 News.